Am I audible at the back? Can you hear me, in other words? Okay, I'm hoping I am. Let me start by telling you a little story. You probably will figure from my accent that I grew up in another country. I grew up in the southwestern part of the Republic of Ireland, out in the country. I am what's known in Ireland as a culshie, and if you want to know what a culshie is, come and chat to me afterwards. In a community of 800 people, we had one person with a mental health problem. Not bad. Pretty good, right? 1 in 800? Pretty good ratio. How would you know? Well, here's how you'd know. You see, when people talked about John, they did this. Or when John was out with his mum and his dad, they talked to his dad, and they talked to his mum, and they talked to his dad, but nobody talked to John. If you're somebody who knows a person with a mental health problem, no, let me change that. If you're somebody who's in a loving relationship with anybody else, can you imagine what that was like? It's a pretty horrible experience. So firstly, I want to say I am so grateful for being asked to come here and talk about mental health today. It's a personal, very important issue for me, and I am happy to have been asked, in spite of the fact it's the first day of spring, in spite of the fact that I drove in from Napanee. It's wonderful to be here. It's really a pleasure and a privilege for me to be in a room with people who want to hear about mental health, who want to understand more, and who want to understand how we can compassionately, as a culture, as a society, respond to people with mental health problems in a way that doesn't worsen their mental health. Because referring to somebody like that didn't do anything positive for John's mental health. I come from a generation that really did not do a very good job on the issue of mental health. We, as a generation, have made the problem of mental health a great deal worse by our judgmental, stigmatizing attitudes, and by behaviors that have only worsened the pain and suffering of a mental health problem. The pain of being ostracized from your loved ones, your community, or your colleagues. The pain of vilification or neglect or sometimes physical abuse are as distressing as any mental health problem. Much more destructive to our morale and much more destructive to help seeking. Truly, all of these are soul destroying. Now, with regard to mental health in the schools, and mental health in the classroom is my topic, I can assure you in the remaining 8 or 7 or 8 minutes that are left to me, I will not cover all this in a comprehensive way. So let me say most of my experience with regard to the classroom has been in the post-secondary sector at the university and with other colleges and universities across the province. But I will refer to people younger than post-secondary students. We are fortunate to have 3 post-secondary institutions locally. We have in excess of close to 30,000 students. These are people in the age range that we consider to be the most vulnerable for the development of mental health problems. As well, we have thousands of younger students in junior schools and high schools. And we're beginning to become aware of our need to pay attention to the risk factors for developing mental health problems, including interpersonal and social risk factors such as, for example, bullying or cyberbullying. We know that these are important factors in the development of mental health problems. And I'll come back to at the end to this. They're also crucial, important factors to understand and to deal with as forces which unfortunately undermine and destroy the hope of young people. So, when I consider these groups, there are 3 things I'd just like to mention to you today. The first is ensuring that we understand mental health is a continuum, just like physical health. All of us know the difference between being in top physical health, feeling good, feeling energetic, and having a head cold. Head cold is, fortunately, thankfully, it's called the common cold because, aside from being cold, it's very common, right? It's very common. And we don't panic when we get a head cold. And we don't say, oh gosh, immediately into the emerge. We remember that it's a common thing, but our health is disrupted. We know there's a difference between the common cold and having influenza. Influenza is quite serious. But we also know that we can have much worse physical health conditions than influenza. Mental health is akin to that. We can be in peak mental health condition, and we can move from peak mental health condition into what I call mild disruption, which is stress and strain associated, let's say, with responsibilities of work or home. It disrupts our mental health functioning a little, but like the common cold, with good self-care, a little bit of patience, it'll be okay. We can move from that into a more disruptive state where the mental health problem is becoming more prominent and our day is being interrupted and perhaps our sleep is being interrupted. Let me quote Shakespeare. Sleep knits up the raveled sleeve of care. Sleep is fundamental. When our sleep is disrupted, we're not good. Please don't come and tell me if you're the only person I know over the age of 20 who's never had a difficulty with sleeping at some point or another. Most of us do. And you know what that can be like the next day. When your sleep doesn't work well for a couple of weeks at a time, you can imagine how debilitating that is. And then at the extreme end of mental health problems, we have situations where the problem becomes so debilitating and our functioning becomes so bad, so disrupted, that we cannot function in our regular fashion. I mention the continuum only because I want us to be aware that there are so many things that we as individuals can do to support each other's mental health, long, long before the mental health problem becomes so disruptive. Not ostracizing people, by the way, is really good for them. Encouraging their participation, really good. Being nice to people, it's really good. Second thing I want to mention, and Dr. Mill, I've already referred to self-stigma, so I won't spend a huge amount of time on it, but I want to mention one part of it. We have to find a language and words to help ourselves and each other to deal with self-stigma. Self-stigma is when we take in, to use a technical word, the crap of life into our head about mental health, and we start to actually believe it. We believe in the notion of people being weak or stupid or incompetent because they have a mental health problem. And we can only begin to imagine what a barrier that produces for us when we need to reach out for help. Now imagine what it's like for an 18-year-old who is coping for the first time with ideas that feel totally out of control, only there's no quite good way to say it because they've absorbed the values that our culture teaches about mental health. We have to find words and a language. Although I do research, I am fundamentally what I call a retailer. That's my job. I'm a retailer. And what that means is I want to work on the issue of stigma person by person, by talking, by engaging in discussion, by working with individuals. One night I had a group of people, we had a group of people at our house, well-educated, intelligent people, all parents of teenagers, only 6 of us. I was working at the university at the time, it was a number of years ago. And one of my friends, I was talking about my job at the university. I'm head of the Counselling Service, so I counsel students and I supervise other people and so on. And she said, your work must be really difficult, you know, working with all those crazies. I was completely taken aback. I didn't know what to say. I found my voice by the end of the night. But of course I'm thinking, these are people with problems. Actually, I'm going to tell you, they're your friends' children. They're my friends' children. their essential humanity is not in any way altered by the fact that they have a mental health problem. Third one I want to mention is the issue of helping our young men to acknowledge personal and psychological pain before it becomes overwhelming. Helping them to find a voice to say it's okay to acknowledge that I'm in pain or in distress or feeling overwhelmed, that I don't have to wait. We seem to do a better job with encouraging young women to speak about their distress and pain, and not such a good job with young men. Funny how times have changed. Many years ago, it was seen as a weakness that young women would come and acknowledge being in distress or pain. Now, I want to say categorically, I tell people, self-disclosure of a mental health problem is an act of courage. Self-disclosure of pain and distress is an act of courage, especially in a culture where our history tells us that when you disclose this pain and discomfort, you're going to be punished. Remember John? Finally, I did say 3 things, but I'm not good at counting. It's actually 4. Or tell that old story. There are 3 kinds of people in the world: those who can count and those who can't count. Working that one slowly. It's a good joke. I want to talk about hope, and I want to talk about hope in the context of our young people, people aged 8, 15, 22. One of the wonderful advantages of growing older, there aren't a huge number, but they're wonderful ones. I have pictures of me with black hair to here, by the way, real hair, not a wig. One of the advantages is we learn a bit of wisdom about the passage of time. We learn that, as I say so many times, this too will pass. I'm going to finish with a little story about hope. So, when I see students for the first time, and often they're in distress and they're dealing with difficulties that they haven't dealt with before, I often end the session by saying to them, okay, we have a plan. Now I'm going to tell you something before you leave. What I'm going to tell you is, truly, this will get better. You will feel better, honestly. We'll give it a bit of time, do the work that we've set out, you will get better. It's not trite, by the way, truly. I have a friend who said, you say that to students? Is that why we sent you off to graduate school? I do. So one day last fall, 2 years ago actually, a student came in with her mum. Lovely young person, lovely parent, very concerned. Student was in 3rd year, very competent student, done very well, but was feeling overwhelmed. In fact, was debating whether or not she should leave. And she and her mom and I were talking about it, and I was doing the counselor thing, which is not telling her what to do. Take your time, make some decisions, chat with your mum. As the session ended and she was getting up with her mum to leave, I looked at her and I said, you know, it may be hard to believe today, but this will get better. Honestly, it will get better. A look came over her face that told me, I don't believe a word you're telling me. But she's young and polite. I didn't say anything. She left. And a week later she wrote to me and she said, very nice, polite young person, dear Dr. Condra, thank you very much for spending time with me and my mum. It really helped. We talked a lot afterwards. New paragraph. When I was leaving, you told me things would get better. I didn't believe you. Of course, I knew, oh, thank God I figured that out. I knew you didn't believe me. I didn't believe you. New paragraph. Now I believe you. Sometimes, with young people in particular, we need to tell them there is hope, that there are things we can do, that there are ways in which you're not the only person being bullied. And because somebody calls you a bad name doesn't mean that is true. Let's work on giving hope. Thank you all very much.